For the sixth straight year, Rochester, Minnesota is home to the #1 hospital in the country. But this year's ranking by U.S. News and World Reports amid the COVID-19 pandemic means even more to the Mayo Clinic.
This really comes down to the 70,000 staff who work at Mayo Clinic. I'd say it's the biggest challenge that we've faced as a country during my lifetime.
And Dr. Sean Dowdy says the challenge continues. As co-creator of the Mayo's COVID tracker, Dr. Dowdy has mapped the quick burn of Delta variant hotspots across the country since June, and he's done the same across Minnesota counties. And his forecast for the next 14 days shows the trend continuing.
What's the level of concern here?
Yeah, the threat from the Delta variant is real. I would be surprised if we don't see another surge in Rochester sometime between mid to late August or September. The signs are pointing to that.
Minnesota cases have already grown to 17 per 100,000 currently, but the Mayo model projects that number to more than double to 37 in the next 2 weeks.
I'm not saying that we're going to run into a crisis, but we may have a surge that approaches what we saw this winter later in the summer. I hope that's not the case, but we're certainly prepared for that.
A major piece of that preparation includes increasing the staff vaccination rates. More than 95% of physicians are vaccinated across Mayo Clinic sites, but overall staff rates range from 75 to 85% depending on location. Yet instead of a full vaccine mandate, they're trying something different.
We have instituted a program where either you get vaccinated or you're required to complete training to hopefully bust some of the myths about vaccinations.
Some may say these are people who are working in healthcare at one of the top hospitals in the country. Why wouldn't they already have that information or want to get vaccinated then?
They're not immune to some of these myths about vaccination. And it's a difficult balance between personal choice and social responsibility. And so that's a difficult line to walk.
Could that potentially change with full FDA approval or something else?
Right now, the vaccine is under an emergency use authorization. I think that's a barrier for some people. I think the conversation will continue to evolve over coming months as we see surges in other parts of the country as well.
In Florida, the surge is already underway, and it's tested the Mayo's #1 ranked Jacksonville Hospital unlike anything they saw last year.
Well, that's about a 300-bed hospital right now. Over 100 of the inpatients have COVID, and this happened very quickly. And you can imagine the impact of that if a third of your patients have COVID. We're starting to see this ramp up in Arizona as well.
He says the Rochester Hospital and the rest of Minnesota may fare better because of our higher vaccination rate, but he says that protection is relative.
We still have pockets throughout Minnesota, Wisconsin, the rest of the United States with very low vaccination rates, and they're going to be fuel for the fire that's coming our way.
And he says not everyone caught in harm's way will be there by choice.
Patients who may have been vaccinated but are immunocompromised and so didn't mount a response, and then they still get it from their friends or family who are not vaccinated. That's the biggest worry that I have, is even the people who have done everything they can to protect themselves may still end up very ill from this.
Now, it's important to note that as we approach another potential surge, the Mayo Clinic and other hospital systems know more and have access to therapeutics and other treatments that weren't available in the same way last winter. That should help improve outcomes, Sharon.
Well, so Kent, I'm kind of thinking back to last year as things started to get worse. Hospitals like Mayo did get rid of elective surgery. So did they tell you anything about what their plan was this year?
Yeah, they actually already had to do that a few weeks ago in Florida, and they've actually had to send ventilators and supplemental oxygen from Rochester to Jacksonville. Of course, they're hoping they don't need to do that here, and right now they are still doing okay, I'm told, in terms of that bed capacity.
It's kind of like a wait and see approach. Thank you, Kent.